Our next presenter, as Dr. Ballinger mentioned, is Jill Henry, who is the CEO of the Susan G. Komen Tissue Bank at IU Simon Cancer Center, Comprehensive Cancer Center. This is an incredible resource, and we wanted her to come and talk and tell our researchers here, as well as those who are from IU, about this incredible resource that they've developed for many years, actually, at this point. So please join me in welcoming Jill Henry.
Okay. Short people problems here. Okay, hi. Thank you, everyone. Thanks for inviting us here. Sometimes our presentation is a little different. It's not really about research. It's more about a research resource. But it definitely has a lot of connection to some of the talks that you've heard earlier today, including Tara. We're excited to work with her, and Dr. Kuhl, some interesting connections that I'll bring up. And also, I'm a little self-conscious because I am giving this talk, but two of our founders are sitting here in the audience, so really they should be up here giving this talk, but I will do the best I can. Shout out to Anna Maria and Connie. But one of the interesting things that I noted from Dr. Kuhl's talk was that really connects with the Komen Tissue Bank is women want to choose, and I'll talk a little bit about that when I talk about how the tissue bank got started. All right, here we go. This is a timeline of the tissue bank, and I won't go through all of it. I know we're a little bit running behind, but Connie, who's in the audience, was at a scientific conference like this one and heard from a researcher who wanted to use some normal breast tissue in her research. You know, where can I find such a thing? And the general consensus was, sorry, there isn't any. You know, you're out of luck. And Connie just thought that was a little bit crazy. So she said, well, why don't we let women choose? You know, why can't we ask the women, do they want to participate in this kind of a way and provide normal breast tissue for research? And she got together with Dr. Storniolo and made it happen. And here we are 17 years later, probably more than that, actually, almost 20 years later, and we're going strong. So it's unusual. People are surprised to hear that women will give a piece of their breast for no other reason than to further research, but it really happens, and it's really amazing to see. So some of you are welcome to come down to we have 2 tissue collections later this year, September 30th and November 11th, where we're always looking for participants, but also volunteers. It's in Indianapolis and downtown at the Cancer Center at IUPUI. So that all started. It started in the early 2000s, and there's a little random 2018 that's not in the right place on my slide. But anyway, here we are today, and moving right along and collecting a lot of samples from women. We've collected samples from over 5,700 women, and a lot of those, several hundred of those are people that have donated more than once. Okay. So what the goals of the tissue bank are to acquire breast tissue and blood from women in all walks of life and all phases of life to provide to researchers around the world. We've really worked hard to increase the diversity of our participants over the past few years, and we're doing pretty well with that. Another important thing that we do is share the data. So I'll talk about that in a minute, but it's important for us to disseminate the data and not silo the data so that people can learn from other research that's been done using these samples. So other than during the pandemic, we try to hold 2 to 3 tissue collection events each year. These are kind of unusual. They're on a weekend, they're in a clinical space. We try to kind of set up a little assembly line, which sounds a little bit weird, but it works well. We try to collect from about 100 to 200 people at each day. So on one particular Saturday, we can collect samples from quite a lot of people at once. We use a lot of volunteers to do this. We have a really small staff. So if anybody wants to see it all in action, it's fascinating to see. It's really an empowering and positive day. So we welcome you. We have an online sign-up portal for that if you want to participate. We process all of those samples right there that day so that they're all processed exactly the same way according to strict SOPs so that there's no bias within the samples for people that are doing research. This is a little walkthrough of the donation process. Everyone goes through all of these steps. Everyone signs up for an appointment time in advance so that we can kind of plan to have a smooth day with no, not having a lot of people show up all at once. So we have about 5 people every 15 minutes coming. So they come to donor check-in. They go through the informed consent process. We are a clinical trial. We also ask a lot of questions on our medical questionnaire. A lot of the questions we ask are having to do with risk prediction so that people can calculate risk scores for our participants, or people can understand a little bit more about the samples when they're using them to identify samples that are very specific to what their cohort needs are. We get a blood draw. They go through the tissue donation process. And then we also try to make it a fun day with coffee and smoothies. And then we have people check out. We give them a post-operative procedure handout, and we give them our phone number in case anybody has a question about anything that happens afterwards, and send them on their way. It takes about 60 to 90 minutes for each person to go through the process. So these are, this is a list of what some of the data is that we collect. It looks like a lot, and it does take quite a little bit of time for some people when they go through the process, but it usually takes about an average of 15 minutes per person. So at baseline, which this was my first time putting together these slides, and they have a few typos, but my little E is behind my picture. At baseline, we collect all of these things in the top parentheses, so reproductive history, family history, medical history. We weigh and measure everyone, which some people think is the worst part, because we didn't want to take people's word for it. Tobacco and alcohol use, exercise and activity. We collect mammograms from women who are of age to get a mammogram. And we can work with researchers who are interested in specific projects to customize this and ask specific questions that might not already be anticipated, but we've tried to include as much as we can. And then annually, we try to follow up with every participant once a year to ask them basically 5 questions, primarily interested in wondering if they've developed breast cancer or any other cancer, or if they've had a pregnancy, if they've been tested for genetic risk, and if they've developed any other comorbidities that we have a list of. So it's really important to hear from people once they've participated to see if they've developed these things. A lot of people think like, well, I haven't developed a cancer, I don't need to get back in touch. But actually, it's just as important to know who has not developed a cancer as it is to know who has developed a cancer. So this medical follow-up is what we call it. We've started that in 2014. We send people an email in the date of the month of their birthday and ask those questions. Then we try to do some follow-up for people that we don't hear back from. So we've gotten a medical follow-up from quite a few of our participants. We usually get responses from about 50% of our donors each year. It's not always all the same people, but that's pretty good. We'd like to have it be better, and we're trying to work on some ways that we can increase that participation. So if you donate to the Komen Tissue Bank, or if you're looking for samples from the Komen Tissue Bank, one person can contribute quite a few samples and sample types to our bank. Everybody who donates, we collect blood and tissue. And then the way we process things allows us to have whole blood, DNA, fresh frozen breast tissue, cryopreserved breast tissue, tissue blocks, H&E images, serum, plasma. Sometimes we'll do some cell lines and also mammograms. So one single donor can create a lot of different samples, and we also can use this in a customized way for people who have research that needs a particular type of sample. And we've had a few projects with people here at Purdue, so we'd love to partner with anybody who's interested in working with us as well. This just shows you a little bit of a feel for how many of each tissue type we have in the bank. We have 24,000 mammogram images. That's not from 24,000 people, but we basically have mammograms from around 2,000 people. And we've had some collaborations with various people to kind of take that big chunk of mammograms and do some AI and look at them and try to learn some things from that. And we've partnered with other researchers around the world. I just had an inquiry from Australia. We've had over 200 projects that have used our samples over time. This is just a little bit about our participants. It's a nice age distribution. You have to be at least 18, and we've had some people in their 90s. We're trying to focus on getting some more young people in the 20s. We actually did a tissue collection here in Lafayette in 2010, where we had a lot of Purdue students. That was great. So we're trying to work to keep getting more young people to participate. And we're doing a great job of getting diverse participants. In 2012, when we had a project with the Super Bowl in Indianapolis, we really started focusing on that, and we've got one of our staff people who's just gotten her PhD in health communications, who really focuses on recruiting and working with diverse populations, including the group that Tara mentioned, Pink Forever, Ending Disparities. So we have a lot of community partnerships to try to reach out to those groups. But we're always looking for more participants, people of color especially. So we have these events called Tasty Talks, where we invite people to come and just learn about the KTB and try to see what it's like in a non-threatening, just informational way. So if anybody is interested in coming to one of those, it is in Indianapolis, but it's free food. This is a booklet with different languages that we've developed. This is kind of an evergreen piece of material that has a lot of information about why it's important to donate to the Komen Tissue Bank and what it's like and what people will go through as far as the process goes. And we've tried to target that to different communities by making it available in different languages. We also travel to various places. Again, one of the main reasons we do that is to increase the diversity of our donation population. So Indiana is pretty white. So we've traveled to other places around the country, and we're always looking to go to places that have a more diverse population to increase the participants in those groups. But we're also often looking to go to places in Indiana. We were trying to go to Bloomington right before the pandemic happened. We would probably definitely be open to coming back to Lafayette at some point. We have a couple of online resources. On the left is our website. So that is a place where someone could sign up to donate. They could sign up to volunteer. They could look at research resources. So it tells you how to request samples. It tells you all of the manuscripts that have been published using samples from the Komen Tissue Bank. It's important for us to, again, share the data from that research and help other people to learn about it. And on the right is what we call our virtual tissue bank. This is where we post the data that people return to us from research that's been done with the Komen Tissue Bank. So you can see experiments, you can download mammograms, you can see H&Es, you can search and do some preliminary filtering based on the data that we collect from our participants, and you can see, is this particular cohort available of samples that I'd like to use? But then we also have the experiment data. And then a subset of that is called Liphomic. It has more rich data. There's some whole genome sequencing data uploaded there, and it also has all of our other annotation data and things like that. So it's a little bit of a deeper dive into data for our samples. Other tidbits, there's been more than 90 manuscripts published. They're all on our website. We are looking to start collecting from other out-of-town events. We're talking to some people in New York right now about returning there. We're working to update some of the linkages with the Indiana Cancer Registry and also the National Death Index so that we can have the most current information about our participants. It's great when we hear from them, but it's also important for us to get some of that more institutional data that has, self-reported data can have some limitations in that the institutional data is a little more robust. We are always looking to collaborate, always welcome to have researchers request our samples, or if you're interested in doing something unique with us or partnering, like Tara's study that she's talking about for next year, we're very interested in that. And that is it, mainly. That Cancer Epidemiology, Biomarkers, and Prevention is a little cover story that used our samples, so we were kind of proud of that. But I am open to any questions. I forgot to put my email address up there, but I'm open to any questions that you all have. Thank you.
And Maria's out there.
Do you want to talk about men?
I love talking about men. I forgot to say this, but we, in November, started collecting tissue from men. This is something that kind of has been bubbling for a little while, not a lot, and we had a person who was interested in supporting that effort, and so we did some research and talked to some physicians about trying to make sure we didn't cause any problems. It's a lot easier to take breast tissue from women. Men, some of them have more, some of them have less. But we did a pilot in November where we collected samples from 10 men, and then in June we did a men-only collection where we collected samples from just a little over 20 men. And so far, so good. That's been going well. So we are open to having men donate because men do get breast cancer as well. And there's some research that's being done at IU to try to understand that a little bit better. So we are open to that. We probably aren't going to collect from men at the September collection, but more likely at the November collection. We have a lot of volunteers who staff our events, and we sometimes struggle to get physicians to come and help because they're busy and whatnot, and we need to have the exact right physicians to do that collection from men. We need to have radiologists who have that experience. So November will be a time when men can donate if they want to. Anything else I forgot? Go ahead, Stephanie.
I am the Vice President of Development for the Catherine Peachy Fund, so I feel like in this room I should say I am not a physician or a PhD or any type of medical professional. But I am a 2-time tissue donor to the Komen Tissue Bank, and so anyone in this room that is man or woman who is considering possibly donating tissue, I just want to let you know that it really is a painless, in my case it was a painless process. I have no scarring from it, and it's really fun. I know that sounds odd, but they cheer for you when you come out. They give you a beautiful Vera Bradley gift or some type of gift, and it's amazing.
These are the things we can't say.
Okay, sorry. Well, but I'm not affiliated with
No,
the
I know.
tissue
That's why
bank,
you
so
can say
I
it, but
can
I
say
can't
it.
say
So I just encourage you to do it. It's really a way to participate in research and give a part. I mean, I know most of you are participating in research, but to give a part of yourself to research. So I just wanted to say that. I also wanted to say that the Catherine Peachy Fund loves collaborative research. It is so exciting for me to see people that we fund at IU and people that we fund at Purdue here together sharing information. And I encourage you, if you have ideas for collaborative research, particularly utilizing tissue from the tissue bank or in any type of prevention research, to think about letting the Catherine Peachy Fund know about it and see if there's a way that we might be able to help. So those aren't really questions, but I thought they were relevant.
We appreciate the support of the Peachy Fund, which has been there for the KTV since the beginning, and also it just, the theme of giving women the opportunity to choose is really important for us, so appreciate it.